Today is World AIDS Day. It has been 40 years since the start of the epidemic, and Black populations globally are still experiencing some of the worst outcomes in prevention and treatment. We have come together today as the Global HIV Collaborative to state our demands for the next 8 years if we are going to reach the UNAIDS 2030 transmission targets. The Global HIV Collaborative is a collection of individuals and organizations from around the world that have come together in solidarity of a common goal to demand action on health equity for Black populations globally. I'm Dr. Vanessa Appiah, and I'm a consultant physician in sexual health and HIV medicine based in London, England, and I am a member of the medical board of NAS. I am a proud member of the Global HIV Collaborative, and as a member, I am calling for a national strategy with a clear commitment to significantly improving outcomes for Black communities in HIV prevention and treatment across the UK. A strategy that calls for action and accountability.
I'm Daison Dixon-Jallow. I'm founder and president of Sister Love Incorporated in Atlanta, Georgia, and founder and president of Sister Love International South Africa in Johannesburg. I also am a very proud member of the Global HIV Collaborative. And in my regions, and as a member of the collaborative, we are demanding that the response to HIV and getting to zero means that we must center Blackness in all efforts to end the epidemic. No matter where we are on the planet, Black and Brown people continue to experience the disparities and the undue burden of the HIV epidemic. And second to that, we must also center women and girls in all of our diversities. Meaningfully achieving the inclusion of women and girls in every response, in the research, in the prevention, in the treatment, the care, the advocacy, as well as the policy decisions, means that we might achieve the end. Without women and girls, there is no end to this epidemic. And thirdly, we must center justice and equity. A people-centered approach to ending HIV means that we also address the intersecting oppressions that continue to drive HIV in the lives of Black and Brown people. Racism, sexism, xenophobia, homophobia, transphobia, even the stigmas and the discrimination that all are associated with HIV and HIV-related conditions. All of these approaches are absolutely necessary, and we call for them now.
My name is Walter Jaoko. I'm a professor of medicine at University of Nairobi. Not only teaching medicine, but I also involved in research, primarily on HIV/AIDS. On this World AIDS Day, I would want to urge the world to support two things. One is more funding for research into getting preventive technology, and particularly the HIV vaccine. We know that the preventive HIV vaccine is a sure, guaranteed way of ending the HIV pandemic. And two, we need to get more evidence research on treatment. As the Global HIV Collaborative, we want Black populations globally to be front and center of any plan to reach zero transmission by 2030.
Hello, everyone. My name is Doreen from Nairobi, Kenya. I'm a social influencer and also the founder of I Am a Beautiful Story. I'm from the East and Southern African region, and I'm also a member of the Global HIV Collaborative. Today on World AIDS Day, I want to call upon the world to give power back to the community, partner with community organizations in the HIV response, and also take specific actions to address gaps in the HIV care, treatment, and prevention. As we know that the solutions that are there are tailored to be a one-size-fits-all, but we need specific actions when it comes to the HIV response. That's my ask for today. Thank you.
My name is Emma Sutton, and I'm Senior Policy Lead at NAS, based in London, working on the Global HIV Collaborative. As part of the collaborative, this World AIDS Day, I'm calling for action from governments, institutions, and international agencies on the development of strategic responses that prioritise Black populations in the fight against HIV over the next 8 years, as we work towards the 2030 ambitions to prevent it from being an all-white success story.
I'm Mark Thompson. I'm the director of the Love Tank, a community interest company that works to address the needs of marginalised communities in the UK. I'm also a very, very proud member of the Global HIV Collaborative, and I'm a man who is living openly and unapologetically with HIV. In my region in the UK, on this World AIDS Day, I'm calling for a strategy, resources, and investment, by that I mean money, that centres Black communities and brown communities in the response to the HIV epidemic. We continue to be disproportionately affected, but the response is not disproportionately in our favour. My second ask is that Black, queer, bi, gay, and same gender-loving men, who are 15 times more likely to acquire HIV globally than white gay men, are also put front and centre. We cannot do this unless we challenge the homophobic laws which criminalise our love and impacts on our HIV risk and how we access and engage with HIV and preventative services.
Hello, my name is Parminder Sekon. I am CEO of NAS, a Black and Asian and minority ethnic-led HIV and sexual health agency based in London, working for the last 30 years. This World AIDS Day, I want us to remember that these past 4 decades have not been an equal fight for Black and brown people living with HIV and affected by HIV. It's not been equal in strategy. It's not been equal in investment and resource. It's not been equal in terms of access to treatment and care and support. And it certainly has not been equal in terms of health outcomes. This World AIDS Day, we're not looking for charity as the Global HIV Collaborative, but we're looking for health equity. We're looking for Black-centered commissioning for 2030 to be a success, to reach zero transmissions. We have 8 years to do this work, 8 years to change the story, to change the narrative, to change the graphs. So we want to champion the health needs of Black populations globally, and so that Black populations can be front and center of any initiative, any global strategy that aims to reach zero transmissions by 2030. And that's what we're all calling for as the Global HIV Collaborative.